And welcome back to the Stay and Watch the Show. I hope that you enjoyed that PSA. We'll have a great time on November 12th over at the Doraville GM site. We're going to have an international food and music festival. Hope you guys can come by. Call my office if you need to get additional information at 404-371-3681. Great time on November 12th. Well, my first guest is Dr. Brian Utley. Dr. Utley, welcome to the Stay and Watch the Show.
Thank you for having me.
Good, good. How are you doing tonight?
I'm doing fantastic.
Good, good, good. Now, a lot of people have their fears about chiropractors.
I understand.
Tell me a little about what chiropractors do. What do you do? What do you do?
Well, it's a healthcare profession that focuses on restoring and maintaining the health by adjustments of the spine. If the spine gets out of alignment, it pinches the nerve, and this causes pain and dysfunction. So a chiropractor's job is to locate these misalignments. We call them subluxations. We use our hands or various instruments to remove this subluxation and allow the body to operate pain-free, so to speak.
Okay. Well, most people think sometimes that, you crack backs, that you take the spine and you push in certain areas and crack the vertebrae. Is that true, or you do anything with the muscles or neurostimulation?
First of all, we don't like to use the term cracking backs.
That's a street term, cracking backs, okay.
It's a general term where chiropractors, they use adjustments, so to speak.
Adjustment.
And this is a specific type of movement because the bones in the spine move in 14 different directions.
14 different directions.
So it's important to, when you give an adjustment, you be very specific in order for the patient to heal effectively and in a timely manner.
So who are some of your patients? Are they accident victims, or are they people that come in that have chronic back pain? Who normally would be your patients?
Well, a lot of our patients tend to be people coming in for wellness care, so to speak.
Okay.
There are accident cases, but it's so much more about chiropractic. We see pregnant women, we see infants, we see teenagers, athletes, and whatnot. So it's a broad spectrum.
Oftentimes people figure out, at one time, healthcare coverages did not cover chiropractic services. The general insurance now, the Aetnas and Cignas and United Healthcare, is that generally covered now for
most
chiropractic?
Definitely, most definitely.
Okay, so they can rest assured now that this service can be paid.
Yes, sir.
Talk a little bit about the spine. I know some people say they have sciatic, what is it?
Sciatica?
nerve.
Yes, I
What is
understand
that? Tell me what that is.
Well, what you have here is your spine.
Okay, you want me to hold that?
Yes, please.
Okay, all right.
And with your spine, you have your brain and your spinal cord. This is your central nervous system.
Okay.
This controls every function of the body, whether it be your immune system, your musculoskeletal system, you name it, it controls it.
Okay.
Well, the brain, of course, is located in the skull. It's protecting the skull. But our spine, a spinal cord is protected in the spine.
Okay.
And these bones collectively called vertebrae.
Okay.
Now,
how many vertebrae are I forgot in school?
26.
26 vertebrae. Yeah, I forgot that in school. Y'all did too. Okay, 26 vertebrae.
Well, through stress, the spine can get out of alignment through tension, toxins, and trauma. When the spine gets out of alignment, it pinches on a nerve.
So it pinches on these nerves, which are these little rubber things in between.
Exactly.
And these are nerves between the vertebrae.
Exactly. Whatever that nerve is going to, it blocks the signal, it allows pain and dysfunction, and leads to poor health.
Okay.
So
that's the base side. So this comes from the brain and actually goes down to the base of your pelvis.
Yes, sir.
Okay, so when you're having this kind of nerve, are there any implants to put between vertebrae? I mean, that kind of thing?
Well, there's surgery, but you don't want to get to that point.
Okay.
You really don't want to get to that point.
Okay.
Well, the spine should be looked at as like alignment on a car, so to speak. If you have your car and you get these brand new tires on and you say, okay, I don't want to get the alignment, I already paid too much money for these tires. Well, you go riding on these new tires, and after a while, these tires start to wear unevenly.
Right.
And then after a while, it starts to prematurely wear on the suspension. Next thing you know, your shocks go bad, your struts, your bushings.
So you're saying that's the same thing with the spine?
Same thing with the spine.
So how do you actually go about what you call alignment or realignment? Is it a series of visits to your office or to your local chiropractor? How does it work? I mean, how do you diagnose and you do a plan of treatment, I guess?
Okay, well, first of all, patient comes in, we have a consultation, we talk about the problem, we take a physical exam, see what's going on.
You actually take physical exam, x-rays and all those things?
X-rays, and if needed, and we go from there. And we locate these misalignments through various analysis and whatnot. We find high areas, tender areas, and we correct them. Gentle and effective adjustments.
Gentle and
effective.
Effective adjustment.
Yes,
so a normal, say if you had a normal case, a person come in complaining about back pain, and then you find out through your diagnosis that it actually has something to do with the spine or the vertebrae. The plan of treatment, generally, how long does it take a person to be healed or need to come in for the next alignment?
Well, we work with the laws of the body, so everybody's different.
Mean?
The body is capable of healing itself, but it takes time.
Okay.
And everybody has their own type of time frame in order to heal. Some heal slow, some heal fast. So we give an estimate of what it would take to get you fixed, and we go from there.
So you have like an episodic or recurrent event, you have to come back into the office.
Right. It took you this long to get out of alignment. It's going to take a while to
put you
retrain the
back
body to get back to
into
where.
alignment.
Exactly.
How important are the extremities when you're dealing with the spine? Oftentimes people are laying down flat or face down sometimes. How important is my extremities, my arms, as it relates to my vertebrae and to my spine when I'm working for an alignment?
Oh, very important. Everything
so?
originates from the spine.
Okay.
The muscles come from the spine. They
So
attach
I
to
can
the
have a
arms.
problem with my shoulder, and it could be my spine.
Yes, sir.
Okay.
Most definitely.
Okay.
And
How does
we
that work?
also adjust the shoulders and the ankles and extremities, like
Oh,
you said.
ankles as well?
Yes, sir.
Okay, so I hadn't heard of that one. So what do you do with the ankles?
Well, if it's out of alignment, we put it back in.
Okay, great. Okay, so is there a chemical that you use, dye, anything when you're looking for something specific?
Not necessarily. If there's
Not
a
as a
problem,
chiropractor?
if there's a problem, we tend to refer for MRI if there's unsuccessful treatment to
Okay.
see what's going on. And then if it's out of our beyond our scope of practice, we look to refer out.
Okay. I've noticed that a lot of chiropractors now are using the acupuncture method as a, I guess, an assistant part of what they're doing or something to complement. What do you think about acupuncture and the chiropractic services?
Oh, it's great.
Do you actually do that in your practice?
I have what you call an acupressure tool.
What is that?
It's just a little tool that has electrical stimulation that comes
Like
out
a
of it.
neurostimulator or
Yes,
something?
sir. Yes, sir.
And what does it do? It's like tingle my muscles? I remember when we used to sell those. Yeah,
It actually
neurostimulator.
releases what you call endorphins, and these
Right.
are the brain. It keeps the pain levels down. It releases these endorphins into the body and kind of eases the pain after an adjustment.
Okay. How young has one of your patients been? I know that some of us older persons generally will come in if they have a back problem or chronic back pain. You've seen young patients as well? How old?
I've seen patient 3 days old.
A patient at 3 days old,
3
baby?
days old, yes, sir.
And how did they was diagnosed with a problem with their back?
Well,
or-
they can have certain problems like colic or torticollis, which is a turn in your neck. It's kind of muscle spasm. When they come out of the birth canal,
goodness.
sometimes it's kind of aggressive type of delivery.
Okay.
And their spines are so delicate, so it can get out of alignment.
Okay, see, I didn't know
present
that.
these
I hope
problems.
women heard that. So you had patients as young as
3 days old.
3 days old, not
Yes, sir.
3 years old, but 3 days
3
old.
days old.
What about as it relates to sport injuries?
Oh.
How often have you seen those in football or basketball or tennis or whatever?
All the time. I
All the
had the
time?
pleasure of going back to my alma mater, Southwest DeKalb.
You went to Southwest Academy?
Yes, sir.
We're not going to hold that against you, Panthers, but that's okay. No, that's good.
Yes, but
Congratulations.
thank you. Thanks to Principal Bethea and Coach
Mm-hmm.
Godfrey, I was allowed to help out with the high school football team a year
Okay.
ago,
Uh-huh.
and they had all kinds of various sports injuries, and luckily we were able to help a lot of them get well.
Oh, really? So I know you also participated in the health fair that I had over at Greater Travelers
Yes,
Rest
sir.
not long ago.
Yes, sir.
And you did an awesome job. So you're saying that it can be reimbursed. You do use MRI.
Yes, if
you
needed.
actually have the neurostimulators as acupuncture, so to speak, and you've had children as young as babies, 3 days old.
Yes, sir.
What do you do for old folks?
Same thing. Get them straight.
You get them straight as well.
Yes, sir.
What would you might miss that you want to share with our viewing audience today that they might want to know if they have symptoms or something that might have them to give you a call or come see you if they're experiencing what kind of pains or symptoms?
Well, pain is the telltale sign.
The pain.
Pain, period. If you
Okay.
have shoulder pain,
Lower back, so what do you mean?
lower back, neck pain, back pain, headaches.
Okay.
We do a lot with headaches.
Okay,
And,
so the person's having a headache, it could contribute to, it could come from,
it come from the spine. Headache
spine.
is a result of lack of
you're not
blood
talking about just a
flow.
migraine, you're talking about a regular headache.
Regular headache, migraine headaches,
Episodic headaches or infrequent, I mean just a headache?
headaches in general.
Headaches in general, okay, all
Yes,
right.
sir.
So it could come from a spine, something as simple as this spine, okay. All right.
It's very complex.
So if we're having headaches, you might want to go see a chiropractor.
Yes, sir.
If I'm having problems with my, you said arm, my extremities,
Arms, extremities, legs, ankles, knees,
okay.
hips.
What are some of the new things that chiropractic professionals bring? I know that we talked about alignment. What are other things? I mean, some people now go into natural healing, those kind of things. What new things on the horizon that you can tell us about from your practice or in maybe the New England Journal for Medicine?
Okay, well, my practice is Utley Chiropractic and Wellness Center.
It's wellness as well.
So
okay.
the wellness, we believe in 5 pillars of health. There's
pillars of health.
rest,
Rest,
nutrition,
nutrition,
positive attitude, very crucial.
okay.
Exercise and chiropractic. We
okay.
focus on these points and we work on,
Put that over.
emphasizing that.
Okay, so the 5 points are very, very important. You said it again. Do it one more time for me.
Rest.
Rest. So you're saying that make sure that you get a prescribed amount of sleep during the day or at night.
All right, learn the art of cat naps. Taking
Or the cat naps, okay, all right, quick cat nap.
Yes, diet,
So
eating
the diet
well.
is very important. as it
Very,
relates
very
to,
important.
Yeah, okay, all right.
Very important. Exercise, if you don't move it, you lose it.
Oh, okay, don't move. I like it. Okay, all right.
Positive attitude. Stress.
No, positive attitude and wellness, okay.
Yeah, stress will cause you to get out of alignment. It creates that tension in your shoulders. When your deadline breaks down your immune system, stress is a big factor.
Okay.
And chiropractic.
And then chiropractic.
Yes, sir.
Okay, well, wonderful. Now, what school do you attend? I know Southwest Cal, but it relates to college.
I went to University of West Georgia for my undergrad in biology.
Okay.
And I went to Life University in Marietta, Georgia.
That's right here in Marietta. What's the guy's name? Sid, somebody?
It's Dr. Guy Rickman now.
Guy Rickman now, okay.
Yes,
Okay,
yes.
Sid is no longer with us.
No,
okay.
no longer with us.
All right, well, so before I let you go, can you give them a website or a phone number that they can probably contact you if they want to know something about your practice or chiropractic?
Okay, well, you can visit
Services.
our website at www.utleychiropractic.com. You can follow us on Twitter at Utley Chiro. You can visit our Facebook page at Utley Chiropractic and Wellness Center, or you can call in 404-516-8376.
Tim, again, I heard it, but where's your office located?
Off Memorial Drive in Decatur, Georgia.
So he's in Decatur, ladies and gentlemen, so make sure that we go out and support him in what he does. Is anybody you want to give a shout out to? I know that Clifton McKnight is your father-in-law. He'll probably call me tomorrow morning or something.
Yes. I'd like to give a shout out to my father-in-law, my mother-in-law, my parents, my brother, my wife, my 2 kids.
Excellent, and 2 kids. Well, we're so proud of them. This is a Southwest DeKalb, a graduate right here in DeKalb County. Dr. Utley is, again, located on Memorial Drive. If you're having a problem with your neck, headaches, he said, sinus, or all kind of crazy stuff,
Whatever.
make sure that you go by and see him. He's not only doing chiropractic, but he said also does wellness.
Yes,
and
sir.
so I think wellness is a great part of what we do. Well, guess what? We're going to take a quick break. Dr. Utley, thank you so much for being our
Thank you for having me,
guest
Mr.
today. I
Watson.
think that was a great interview, and I think you gave the audience a lot of information.
Well, I hope so.
Well, good. We'll take a quick break, and we'll be right back. Don't forget to call me tonight, 770-559-2999. We will take your call. We'll be right back.
Ime o Yan Hispanos.